Fellow Nigerians and friends around the world, this week marks another important step forward for our country as Nigeria, under the leadership of His Excellency President Bola Ahmed Tinubu, begins to roll out the malaria vaccines, starting with all local governments in Bayelsa and Kebbi States. The World Malaria Report had noted that our nation accounts for the highest percentage of the global malaria burden compared to any other country, with 27% of the global estimated malaria cases and 31% of the estimated deaths due to malaria. We accounted for estimated 55% of malaria cases in West Africa. It is in view of this major challenge that our administration has worked closely with international partners, including the Vaccine Alliance, Gavi, UNICEF, the World Health Organization, WHO, to receive the first batch of about 800,000 doses of the malaria vaccine in October. This historic vaccine rollout that is planned supports Nigeria's goal of reducing malaria mortality among children and will commence with the most vulnerable and hard-hit states first, before distribution to all other states of the Federation over time as financial resources and supplies become available. It is important at this juncture to acknowledge the tremendous support we have so far received from the Global Fund, from the Gates Foundation, World Bank, the USAID President's Malaria Initiative, Gavi Alliance partners, UN's Rollback Malaria Partnership, and other cherished development partners and civil society organizations and private sector leaders in Nigeria. Our determination to end malaria is not predicated on the mobilization of this important vaccine alone. We have been aligning all levels of government in Nigeria to adopt preventative measures for safeguarding Nigerian lives against malaria and for ensuring treatment is available for those who need them. Earlier this year, in May to be specific, we worked closely with the Nigerian Governors Forum to rethink malaria elimination, and we identified key shifts and strategic actions to combat malaria in Nigeria and accelerate our path to elimination, including the establishment of an independent advisory group on malaria elimination in Nigeria called AMEN to develop a pragmatic, costed plan for a malaria elimination, which explicitly details the required trade-offs. We also decided to intensify our focus on malaria case management, adopting the Affordable Medicines for Malaria venture experiences and domesticating the context of Nigeria, and also included reforms of the NHA to ensure that the supplies are available and affordable. We also are pursuing the production of associated bed nets for the anti-malaria effort, as well as the expansion of primary healthcare services through our primary healthcare system. In addition, we are retraining Nigeria's frontline health workforce, who are important for testing, treatment, and enhancing community awareness. And this direction is only made possible by the active mobilization of federal, subnational, global, and non-governmental funding for the fight against malaria in Nigeria. I am pleased to report to you that only a few days ago, the Independent Advisory Group on Malaria Elimination in Nigeria, AMEN, held its inaugural meeting in Abuja, led by the AMEN chairman, Emeritus Professor Russell Lecky, who is from Cameroon, as we advance collaborations towards the elimination of malaria in Nigeria. In view of the President's administration's effective planning and implementation of these approaches, in close coordination with subnational governments and our development partners, Nigeria is now well positioned at the forefront of the successful prosecution of the war against malaria globally, despite the prevailing challenges that we know of financing even in the wealthier nations. However, the Nigerian government fully appreciates that antimicrobial resistance, AMR, including anti-malarial resistance, are emerging as significant threats. AMR occurs when microorganisms evolve and become resistant to antimicrobial medicines. And more specifically, it stands as a threat to the effectiveness of life-saving medicines. It is in view of these challenges that we moved quickly, with the President's support, to produce and launch Nigeria's second National Action Plan on Antimicrobial Resistance and the National Genomic Surveillance Strategy in October of this year. Alongside the former Minister of Health, my colleague Professor Onyebuchi Chukwu, and my current colleagues, the Honorable Ministers of Agriculture and Environment, Honorable Minister of State for Health, and the Director General of the Nigeria Center for Disease Control, Dr. Jide Idris. Several of our partners were also present, including our academics here locally, the World Health Organization, Food and Agriculture Organization, USAID, and many more. Their presence highlights our collective commitment to advancing Nigeria's health security, a key pillar of President Bola Ahmed Tinubu's renewed hope agenda for improving the health of all Nigerians. The second National Plan on AMR and the National Genomic Surveillance Strategy are two critical documents that are pivotal to the Nigeria Health Sector Renewal Investment Initiative, which focuses on building a resilient healthcare system, strengthening governance, and securing better health outcomes and health security for all Nigerians. By addressing both current and future threats, these strategies position Nigeria as a leader in health security across Africa and globally. Both the AMR National Action Plan and the National Genomic Surveillance Strategy are closely interconnected. The integration of genomic surveillance with our AMR efforts will strengthen our capacity to monitor bacterial pathogens and detect emerging threats before they spread widely. This synergy will enhance Nigeria's role in the global fight against AMR while simultaneously improving our overall public health security. AMR presents an urgent global challenge, contributing to 4.7 million deaths in 2021 alone globally. Nigeria's second National Action Plan on AMR was developed through extensive collaboration and adopts a One Health approach, integrating human, animal, and environmental health. The National Genomic Surveillance Strategy is equally vital. Genomic technologies will revolutionize the way we detect, monitor, and respond to infectious diseases. By integrating genomics into our AMR surveillance system, we will enhance our ability to track pathogens, anticipate future health threats, and advance precision medicine and public health. I commend Professor Christian Happy at the Redeemers University in Ede for all his great work, which is globally acknowledged. It is also against this backdrop that I am pleased to inform you that Nigeria has been selected to host the global 5th high-level ministerial meeting on antimicrobial resistance in 2026. Nigeria will succeed the Kingdom of Saudi Arabia in welcoming all member states as the host nation of the biannual meeting on AMR and is now taking a global leadership role in defining practical steps to enhance preventative measures using the One Health approach, in advancing access and the rational use of effective antimicrobials to save lives, while at the same time promoting research and innovation to develop more effective tools that will keep humanity one step ahead of resistant microorganisms. The real work now begins, and with the commitment of all stakeholders, I am confident that under the bold leadership of President Bola Ahmed Tinubu, we will make significant strides in building a healthier, safer Nigeria, a Nigeria that plays its part in African and global health security. Thank you.